Very good morning to you all. Do you know that 1 in every 10 adults suffers from a chronic kidney disease? In fact, kidneys can repair themselves with a proper diet and a healthy lifestyle at an early stage. Let's understand more about kidney health in the upcoming episode of Apollo 24/7's Health Hour. Joining us today at 11 a.m. in this live session is Apollo's expert, Senior Consultant Nephrologist Dr. Ravi Andrews. He is going to answer all your kidney-related questions in this live session. So join us and ask all your questions. See you there, 11 a.m. sharp.
माल पूरा है?
हाँ सर,
मम्मी
पूरा है।
पापा टाइम पे
है अपोलो से है सर।
थैंक्स सर। पापा के बीपी का इशू है, so every medicine has to be on time.
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं अपनी पूरी प्रिस्क्रिप्शन की डिलीवरी सिर्फ 2 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show where we bring an expert from Apollo every week to answer your queries and questions in the live session. Get ready. Today we are going to talk about kidney problems, the causes and the cure. Today we are going to be joined by an Apollo expert, nephrologist Dr. Ravi Andrews in a very short while. So please continue typing your questions in the chat box. I see that a lot of people have already asked their questions. Go ahead, type your question or query about kidney issues. We shall take that up in a very short while. Before we start the show, let me also tell you that this show will have gift vouchers, gift coupons, and a health quiz where you can answer 3 simple questions and win gift vouchers from Apollo 24/7 as well. Also, on this show, we are going to give away certain coupons. Wait till the end and do claim the coupons on Apollo 247. I urge you all to download Apollo 24/7 app, because this app brings the entire Apollo into your palm. Your thumb becomes one control for the entire health. So go ahead, download Apollo 24/7, and let's start the show today. Let me also take your notice to this wonderful initiative, which is done by Apollo Foundation and Apollo 24/7. This is called Saving a Child's Health Initiative, which is free pediatric consultations for every child who is in need. Sachi, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 pediatric specialties, expert pediatricians from Apollo centers are taking care of children's health, benefiting children across India. Scan the QR code which is on the screen, and you will know more about this wonderful initiative. And before we start, also let's talk about COVID and COVID recovery. Now that most of us in the country are recovering from COVID, or recovered earlier, we are finding it difficult to get back. What are the long-term issues or complications? Who has to get to an expert to get themselves checked after recovery of COVID? If you have recovered from COVID, post-COVID-19 recovery, you want to understand how you're doing, there is a simple self-checker which is done by Apollo 247. We have shared a link in the chat box. You can do this free assessment. This is absolutely free. Just tap the link, take the 10-15 questions that are there. The app will show you the questionnaire that you have shared will give you a score. Depending on what you have scored, the app will suggest you who you have to consult, what kind of test that you have to take. Go ahead and check for the link which is in the chat. Take the post-COVID-19 recovery self-checkup. Chalo, let's start taking care of our kidneys. Let's understand more about kidney health issues. Joining us today in this wonderful session is Apollo's expert, and in fact, let me call him the star nephrologist, Dr. Ravi Andrews. He is a senior consultant nephrologist at Apollo Hospitals Jubilee Hills, Hyderabad. He has more than 20 years of experience treating patients with severe cases of kidney-related ailments. He is one of the 3 nephrologists in India to perform a successful 3rd kidney transplant in the same recipient in 2012. He is the first nephrologist in AP and Telangana to perform a swap kidney transplant in 2014. He is rated the best nephrologist in Hyderabad since January 2012 till date on an online portal called www.ratemds.com, and he is an author of several papers in international and national journals, and he is the star of Apollo 24/7's Health Hour. Welcome, Dr. Ravi Andrews.
Namaste, everyone. Thank you so much, Jhansi, and welcome to all the viewers to Apollo 247, and thank you, Apollo 247, for giving me this opportunity.
It's always wonderful having you on the show, Dr. Ravi. You bring certain confidence, you give a lot of energy to all the viewers, and you answer questions in such a manner that people look forward to having you. So welcome once again.
Thank you.
So let's start. One quick question. One of my friend was asking that he was having a backache. He was experiencing pain around his ribs and back, and he thinks it's a kidney issue. So is there a connection? Is that pain, which we call a back pain, is an indication of a kidney health? And does a kidney issue always has to do something with pain?
Yes, Jhansi, this is an urban myth which I seek to destroy today on this program. There is a common misconception that any back pain is related to the kidney. In reality, back pain due to kidney disease is very rare. Most of the time, it is some other reason. It could be the spine, or it could be the nerves, or it could be the muscle, it could be trauma. Kidney disease leading to back pain is less than 10%. So in other words, less than 10% of kidney diseases lead to back pain. And among these kidney diseases which cause back pain, one of them is urinary tract infections, where the kidney gets infected, or kidney stone disease. These are the only 2 situations where the kidney disease can cause back pain. So if you have back pain, diagnosing it as a root or a reason being kidney disease, you have to do it by a process of elimination. So you have to look at all the other common reasons, and then finally, when you don't find anything else, you look at the kidneys as the cause. And the easiest way to find out whether the kidney is the cause of back pain is to do an ultrasound of the kidneys. and do a routine urine examination to see if there's any infection.
All right, so let's keep pain aside for a while and understand what a healthy kidney is, or if a kidney is ailing, what are the warning signs or the symptoms that one has to look out for?
Unfortunately, there are very few warning signs. Kidney disease, like diabetes and blood pressure, is a silent killer. So things go on under wraps, and by the time you actually find you have kidney disease, you are already well advanced into it. But that aside, the common signs and symptoms would be swelling of the feet or face, decreased urine
Okay.
output, breathing difficulty, reduction in your appetite, sleep disturbances, itching, and yeah, more or less these are the common symptoms, but they're not that common. Many a time you can have kidney disease without any of these symptoms, but if you do
Right.
have these things, you definitely look out for kidney dysfunction.
Right. So one needs to understand that kidney is, if you have a issue with kidney, pain is not the factor that you're looking out for. These are the other factors that you might want to check. All right. So let me understand how difficult or what kind of effect that kidney issues are having on our society. What is the global health impact of kidney issues? How many people are affected by it?
Generally, the statistics have shown that up to 10% of people all over the world have kidney disease. That means 1 in 10 people that you meet are likely to have kidney disease. And this is the same burden in India as well. In fact, there are some places where 1 in 6 people have kidney disease. So that's a
Oh, that's
huge number,
huge
huge
number.
global burden. Yes, and the
Right.
worst part is this is just the tip of the iceberg, because we don't, many a time people with kidney disease don't have symptoms. So we really don't know unless you actually check them, you don't know. So this 10% is what we're seeing when they have symptoms and you check them. So probably it's more than that. It's probably closer to 20% of people all over the world having kidney disease, and these same statistics reflect in India as well.
Right. So, as you said, that this is just the tip of the iceberg. There must be variety of conditions as well. If we are talking about one condition, we must be knowing only kidney stones, but there might be other kidney-related issues. What are the basic types of ailments that kidney can go through?
Yeah, I will answer this in two parts, Jansi. First part is the basic types. So
Okay.
there are two types. What we call new onset kidney disease, which is also called acute kidney disease, and this
Okay.
is when kidney disease has been there for the last 3 months. There's
All right.
another variety called chronic kidney disease, which has been there for quite some time. It's an older situation where somebody's been having kidney disease for more than 3 months. And it is
Right.
crucial to differentiate between these two, because acute kidney disease or new onset kidney disease can be cured completely. If you can diagnose it and get the root cause, you can cure it completely. Whereas chronic kidney disease, by definition, cannot be cured, but you can only do damage control. The second part of your question, what are the common causes of kidney disease? The common causes of chronic kidney disease would be diabetes and blood pressure, and maybe stones and genetic diseases, those kind of things. The common causes of acute kidney disease are usually medications, painkillers or antibiotics, dehydration, or some kind
Oh,
of obstruction. So a lot of these things are under our control. So if you can avoid taking too many painkillers or antibiotics, keep your blood pressure, blood sugars under control, keep your weight under control, keep your diet under control, drink enough liquids, you can avert or you can avoid at least acute kidney disease. And if you get chronic kidney disease, if you take these care of these things, you can limit the damage.
right. So, common causes, I understand that, especially in acute kidney issues, most of them are in our hands, that we invite them. So, give me a nice list of no's to take care of your kidney health. What are the things that I should not be doing?
Yeah. You should not be getting your blood sugars or blood pressures out of control, so you need to monitor them carefully. You need to make sure you drink enough liquids, preferably water, and 2 to 3 liters of liquids per day is the recommendation. Avoid taking unnecessary painkillers and antibiotics, because these are two common drugs which can cause kidney disease. And another one which I need to emphasize here, which is recently being found out, these things which we use for acidity, things like omeprazole and pantoprazole. These surprisingly have of late been found to be one of the more common causes of kidney disease. So be very careful with popping antacids. So popping antacids, taking painkillers and antibiotics are what you should be avoiding. You need to avoid smoking. Apart from kidney disease, there are so many other diseases that can be caused by smoking, and you need to limit alcohol. You need to exercise regularly. These are all the things that you can do to prevent kidney disease. And it's not only kidney disease that it will prevent, your lifestyle modifications and control of diabetes, blood pressure, and other things can also protect other organs.
So, water is something that you told me that intake should be fine. But what happens if there are again misconceptions and myths around water consumption and kidney health. People generally suggest कि ज़्यादा पानी पीते हो तो आपका kidney अच्छा रहता है. Is that true? How much of water should be taken?
This is a very, very good point that you brought up, because I see so many patients who come to me with swelling in their feet and the blood pressure out of control. And I ask them, how much water do you drink? And they say, we drink 7, 8, 9, 10 liters of water per day. And I asked them, why do you drink so much? They said, if you drink more water, then your kidneys are supposed to be healthy. That's what we have learned. But there is also a limit. The kidney has to filter. You drink 10 liters of water, the kidney has to filter those 10 liters out. Otherwise, it will stay back in your body. And the kidneys are being overworked. So that's also too much. See, in life, everything is in moderation. Too much of anything is not good for you. So too much of water, too much of food, too much of diet, too much of exercise, whatever it is, too much of anything is not good for you. So the ideal amount of water that you should drink, most of the time your body will tell you how much water you need. So if you feel thirsty, you drink. And if you don't feel thirsty, you don't push yourself. But generally the requirement is 2 to 3 liters of liquids per day. And it also depends on the environment you're in. For example, you're in a very hot, humid environment. Yes, liquids,
It's
not water
2 to
alone.
3
It's liquids.
not just water alone. It could be your liquids like
Tea,
soup,
coffee,
salads,
milk,
buttermilk, tea,
buttermilk.
coffee.
Yes. So 2 to 3 liters of liquids, but preferably most of it would be water, because you don't want to be drinking 1 liter of tea or coffee or 1 liter of some beverage or something. So try and keep it. I would say, if you ask me, push me against the wall, I would say 2 liters of water and 1 liter of other beverages per day. The temperature, ambient temperature also decides how much you take, how much activity you do. For example, if you're doing a lot of physical activity, maybe you can increase that by about 500 ml per day. But at the most, I would say never cross more than 4 liters of liquids per day.
Done. So that's a good suggestion. But is there any condition where you would advise the people to have more water than what you've prescribed right now?
The only situation where we advise people to have more water is a post-transplant situation. Post-transplant, to keep the transplant kidney healthy and enough flow going to it, we advise them to have 4 to 5 liters of liquids. But if you find that they're not passing adequate amounts of urine, or they're getting swelling, or the blood pressure is going high, then we ask them to cut down on fluids. But otherwise, the standard recommendation is 4 to 5 liters post-transplant. Otherwise, it's 3 liters. And if you really want to push it, 4 liters, not more than that.
Another water-based, water-linked question to you, doctor. A lot of people, especially from my childhood, pani kam peete ho. If you drink less water, people think that you tend to get kidney stones if you're dehydrated. Is that true?
It's more like a trigger. Kidney stones are formed with a combination of a genetic tendency to form stones with an environmental trigger. So if you have a combination of those, you will have kidney stones. Just drinking less water alone in a person who's not prone to getting kidney stones doesn't necessarily mean that he will get it, but definitely you're going to increase the chances. The other way to where your chances of getting kidney stones are if you take a lot of non-veg protein, animal protein, or if you have a high uric acid tendency and you take foods which are rich in uric acid, or if you drink too much milk or milk products. But all this depends on the genetic tendency, and you can really not find out about the genetic tendency, because sometimes your parents might have stones, sometimes they might not, even though you have a genetic tendency. So blaming poor fluid intake alone for kidney stones, I don't think is correct. But if you have a tendency, then definitely you have to drink more fluid to reduce the chances. It's all about risk limitation. There's nothing that can prevent or start anything. It's just about limiting the risks in particular situations.
Right. So coming back to your experience and expertise, is there a cure for ailing kidneys or kidney diseases?
The first step is awareness. The second step is early diagnosis. And if you can diagnose a kidney disease within the first 3 months, there is a very good possibility of cure. But to
Nice.
diagnose it, you have to have basic investigations. And sometimes, as nephrologists, we advise a kidney biopsy to find out the cause of the kidney disease. That will help us to tell the cause, to decide whether it's acute or chronic, to decide what would be the best treatment, and to decide approximately how long it might take you to recover and whether you will recover or not. Now, this word biopsy, whenever people hear that, they think immediately of cancer. It's not. Biopsy is just an investigation to get a tissue diagnosis to find out what exactly the problem is. So biopsy does not necessarily equate with cancer. Biopsy is done to make a diagnosis. So that would be the key to understanding what the kidney disease is and treating it appropriately.
Right. So as you were talking about chronic kidney disease doesn't have cure, it's only management. So what kind of management and how long does one have to be on this management protocol?
The common causes of kidney disease is diabetes and blood pressure. So as soon
Right.
as you have kidney disease secondary to these two things, the best way to limit the damage is obviously to control your blood pressure and blood sugar. In addition to that, you have to keep your weight under control. You have to make sure that you do any high risk behavior that can cause an acute kidney injury on top of a chronic kidney disease. So if you already have diabetic kidney disease, don't dehydrate yourself. Don't take unnecessary painkillers and antibiotics. Don't indulge in any high risk behavior. So avoid smoking. Keep your weight under control. Make sure you don't have too much protein, but certain amount of protein is necessary. You can't be totally zero protein. So all these recommendations will have to be followed to limit the damage and to make sure you don't get new additive problems on the basic chronic kidney disease. And your nephrologist will be the best person to guide you. There is no single prescription which everybody can follow. It has to be individualized to the patient.
Correct. So my next question is also Mr. Ali Haidar's question. What is a good diet to maintain good kidney health?
Yes, Mr. Ali. Basically, I think we have more or less discussed this. Enough fluids, 2 to 3 liters of liquids per day. Avoid too much non-veg protein. Veg protein is never a problem. Make sure you don't take unnecessary medications like over the pill antacids or painkillers or antibiotics. And keep a close watch on your kidney function. You need to monitor your serum creatinine and blood pressure and blood sugars on a regular basis. Keep your BP and sugars under control. That, I think, is the bottom line, which I'm going to go on emphasizing during this program.
Great. So let me jump into the YouTube chat box where questions are pouring in, Doctor. The first question I wanted to ask you is about from Mr. Patlola Venkat Reddy. No proper urine flow, no motion, but pain in abdomen, swelling in testicles, and swelling and pain in testicles. Is this a sign for a kidney issue?
Most definitely, Venkat Reddy Garu. Most likely, this is a sign of a kidney disease. And from what you're telling me, the history you're telling me, you seem to have something called nephrotic syndrome, or it could be just an acute kidney injury. You definitely will have to get checked up. You'll need to do a urine test. You will have to do an ultrasound, and you will have to do a serum creatinine. These are basics to figure out what exactly is the cause of your symptoms.
Done. Thank you so much. Venkat Reddy Garu, దయచేసి వెళ్ళి టెస్టులని చేయించుకోండి. And Dr. Ravi Andrews can be consulted on Apollo 24/7 as well. The link for his consultation will be left on the chat. Then Gaurav Maji's next question. I'm getting burning sensation while urination, sometime after completion of urine as well. It remains. And I think the burning sensation is after urination as well. Also, I've done many tests, CT, ultrasound, but doctors given medications. The problem continues.
Based on the symptoms you're telling me, Mr. Gaurav, the two possibilities are either this is a urinary tract infection, or you have a problem with the prostate where you're not able to empty out the bladder completely. The way to prove this is to do a complete urine examination, a urine culture, and a specific test called an ultrasound with a post-void residue. That will tell us if you have a prostate problem and urine is being retained inside the bladder and causing your symptoms.
Done. So here's a diabetic, Neeraj Sahai, who's asking, I'm diabetic and There's itching and burning sensation while urination. Does this indicate any kidney issues?
Most likely, Mr. Sahai, this sounds like again a urinary tract infection, which is common in diabetics. So, same test for you as well. You will have to get a complete urine examination and an ultrasound. Looks like because diabetics are prone to getting urinary tract infections, especially if sugars are not controlled. So, please make sure your blood sugar is under control as well.
Yet again, a diabetes question. I would want to continue the diabetes questions here. Miss, I didn't get the name. Mr. Rao SPL, 46-year-old, HB1AC is 8.9, feeling pain while urination. Doctor suggested first to control diabetes. Will this affect kidney?
If you have a urinary tract infection and you don't treat it, it can ascend and infect the kidney and affect it. So you have to make sure you don't have that. And obviously, if diabetes is not controlled, it is going to affect the kidney. So you have to get your blood sugars under control. Ideally, your HbA1c should be close to 7 rather than 8.3.
Right, it's 8.9 actually here. So we need to get it to 7, under 7 or 7.
Close to 7.5, yeah.
So I understand diabetes is a close connection with kidney issues.
In India, out of 100 patients who have kidney disease, 40 of them would be because of diabetes and 25 of them would be because of hypertension or high blood pressure.
Okay.
So this accounts for 65% of all kidney disease. That's a huge number, especially when you consider the number of diabetics and hypertensives that there are in the world and in our country.
That is alarming. One needs to take care of diabetes first and then talk about other ailments as well. Alok Kumar is a renal transplant. He's undergone renal transplant and a diabetic too. What food restrictions for me? Can I take salads?
Yes, definitely post-transplant, a lot of the restrictions would be removed. You can definitely take salads, but make sure they're well washed and clean. And no storing food in the fridge and warming it and eating it again. So that's one thing you have to be very careful about because transplant patients
Why,
are at risk.
doctor?
Because transplant patients are at a risk for infection. And whenever you store food, there's a strong possibility that it might get infected. And when you warm it up again, it might get worse. So no, it's always got to be freshly prepared food for a transplant patient. Salads, fruits, all fine, but ensure that they're washed properly. Otherwise,
So no
specific
external infection.
Sorry, what was that again, Jansi?
Nothing external source of infection should be avoided.
You have to be
Wherever
very,
there's a
very
check.
careful because transplant patients are always vulnerable to infections.
Right. So otherwise, there are no food restrictions as such. It's only these
Just
precautions.
specific, for example, if you're a diabetic, you will have to restrict, food, diabetic foods. If you are got high cholesterol, you have to reduce oils and fats. If you have high blood pressure, you have to reduce salt. Just the general recommendations, but nothing really specific for a transplant patient.
Done. So here are a set of questions from different people regarding creatinine. I'm going to ask all three, but most of them are related. Rajiv Kohli ji पूछते हैं, my blood creatinine is 1.9 and blood urea is 62. Then Sundaram Nagappan, creatinine is 2.9, how to reduce? Uspulava, my creatinine levels have reached the maximum of the limits. Any problem or caution required?
The first thing which I would like to emphasize is whenever you have a high creatinine, you need to find out whether it's recent or it's old. So if you have a facility for pulling out your old reports, say 6 months back your creatinine was normal and now it is 1.9, then it's likely to be something acute and you need to follow it up and chase it and try and find out the underlying reason for this creatinine going up. The upper limit of normal in most labs for creatinine is 1.3 to 1.4. So anything more than that, if it has been going on for more than 3 to 6 months, then we know it's chronic kidney disease. There's nothing much you can do other than damage limitation. But if it is not there earlier and it's new onset, you must meet a nephrologist and figure out the cause. To find out the cause, you will first have to do a urine test. You will have to do an ultrasound, some basic blood work, and possibly a kidney biopsy.
Okay.
Other than for as far as limiting the rise of the creatinine, once you know that it is elevated, is again simple: blood pressure control, diabetic control, weight control, diet control, regular follow-up of your serum creatinine every 3 months, and avoid too much oil, too much fat, and too much salt in your food. Ensure you take enough liquids and don't take painkillers and antibiotics. So it's all individualized. You can't just point out at a creatinine and say, what do we do with this? You need to find out whether it was there before and it is recently increased, or it was not there and now you found out, or it was already there and it's increased now. So based on this, the treatment and the investigation need to be tailored. But whatever it is, when you have an elevated creatinine, you need to go and see a nephrologist and let him figure out what is going on with you.
So I've taken this as a personal alarm call. Do I need to, as a healthy person, not much of a history of diabetes or hypertension, but reaching, understanding health as an annual health checkup, serum creatinine must be monitored, is it? How do I understand if I had the creatinine higher or lower before?
This is a fantastic point you brought out, Jansi. This is something which has been on my mind for a long time. It's been on the mind of every nephrologist. As normal human beings, all of us get a blood sugar at some point in time, don't we? All of us get our blood pressure checked at some point in time. Similarly, all of us should get a creatinine and a routine urine examination done at some point in time, because kidney disease has many a time, 90% of the time, it has no symptoms. How will you know? The only way you will know is if you do a creatinine or a complete urine examination. So today, at the end of this session, if I can emphasize the point that every individual should get a creatinine and a complete urine examination test done at some point in life, my role would have been done. This is what everybody should go through. Like you check your hemoglobin once in a while, like you check your sugar at some point, like you check your BP at some point, you must check creatinine and routine urine examination at some point.
Thank you, Dr. Ravi, because tomorrow I am making sure that I am getting my annual health examination, which includes serum creatinine and a routine urine examination. Because I am worried about my pap smear, I'm worried about my mammogram, which are my annual. As a woman, I go ahead and get them done. This is something basic I need to do along with my blood sugars. Thank you again.
Exactly.
So, yes. Next up, let me get into the audience's questions. This is Vignesh Kadrivelu. I have creatinine 4.4, EGFR 20, but I don't feel any issues. I feel good. Should I need to go for a transplant? And is there a chance to increase my EGFR? My BP isn't under control, 190 by 105.
Vignesh Garu, but all this discussion that we had throughout these last 30 minutes, the same points have come up again. One, blood pressure control is crucial. Two, with a creatinine of 4.5, I'm assuming that this is chronic kidney disease. Definitely, there is a role for transplant. There is a concept called a preemptive transplant. Generally, when we talk of transplants, we talk about having a transplant in somebody who's already on dialysis. But there is a concept where somebody who's got kidney disease, and down the line he is going to get end stage and going to require kidney transplant down the line. So in that situation, if you have an available donor who's a family member, a first degree family member, then you can go ahead with the transplant. This thing about EGFR is again a kind of issue which needs to be sorted out. EGFR is estimated, it is calculated, it is not measured. So it is calculated on the basis of creatinine and certain other parameters. So EGFR is basically a reflection of the creatinine. And in our country, among Indians, the EGFRs are lower. The normal EGFRs are lower than Western population. So Western population, the normal is 100. Most Indians would be around 80 to 70. So most of these standards of EGFR are Western standards. So we can't really go by that. I think a better way to measure your kidney function would be creatinine rather than EGFR. And as to answering your question about how are you going to increase your EGFR, you have to increase your EGFR by reducing the creatinine. It's as simple as that. And reducing the creatinine, if it is chronic, we all know it's not going to reduce, you can just limit the damage. So your option for you would be to go for a preemptive transplant if you want to get your creatinine under control. It has to be a preemptive transplant. Otherwise, limit the damage as long as possible. And once you attain something called end-stage renal disease, which normally is diagnosed when the creatinine is more than 7 or 8, in that situation, you will need a dialysis and then move on to a transplant.
Wonderfully answered. Thank you for throwing light there. Roshni Yadav's question. She has a 7-year-old female child with a nephrotic syndrome. Can you suggest medication is what she is asking. But I think this is not the platform where you suggest medication. Doctor can be consulted on Apollo 247. But can you please throw light on nephrotic syndrome, what it is?
Yes, nephrotic syndrome basically is a conglomeration of symptoms where you have swelling in the feet or in the face, you have protein in the urine, you have reduced albumin in the blood, and you have high cholesterol levels in the blood. So this is the whole thing, 4 parts of a nephrotic syndrome. Nephrotic syndrome can affect any age group, but if it affects somebody below the age of 12, they are likely to recover. Once they cross the age of 12, they'll recover completely. And the treatment for nephrotic syndrome, it's called childhood nephrotic syndrome or nephrotic syndrome in children, is steroid treatment for 12 to 16 weeks. And we have pediatric nephrologists who can take care of this. And with this treatment, the nephrotic syndrome can be completely cured in children. If it doesn't get cured immediately, mostly by the time they cross the age of 12, it will automatically, by the time they attain puberty, it will automatically get cured. In adults, nephrotic syndrome is a different story. There are about 10 different reasons for nephrotic syndromes, like membranous nephropathy, FSGS. I'm just using technical words here, but these things can cause nephrotic syndrome, and they require steroid and immunosuppressive treatment for a prolonged period of time, usually for 2 to 3 years. And many a time they don't respond to this treatment, and these patients move on to get chronic kidney disease and then develop elevated creatinine, move on to dialysis and transplant. But as her question for the 7-year-old child, steroid therapy under the guidance of a pediatric nephrologist should do the job for her.
Wonderful, doctor. Thank you so much. Now I'm checking the chat, the questions. A lot of people are asking the relation between certain medications and kidney causes, kidney issues. For example, can medications for rheumatoid arthritis cause kidney issues?
So yes. All medications ultimately have to go out of the system. So you pop a pill, it has to go out either through the urine or the stool. Most of them have to go out through the kidney. So every medication will have to be understood and, if required, dose modified when you have kidney disease. If you don't have kidney disease, you'll have to be careful, because ultimately these medicines have to pass out through the kidneys. As far as rheumatoid arthritis is concerned, most of the treatments that are used for rheumatoid arthritis, like painkillers, what we call NSAIDs or COX-2 inhibitors, steroids, other immunosuppressive medications, all of these too have to go through the kidneys, and they can definitely cause kidney damage. Apart from the medications for rheumatoid arthritis causing kidney disease, rheumatoid arthritis by itself can cause kidney disease. There are a lot of associations between kidney disease and rheumatoid arthritis. So if you have rheumatoid arthritis and you're on treatment, you will have to monitor your kidney functions very, very carefully and regularly.
Yeah, also thyroid, does it have low functioning of thyroid? Does it have any effect on kidney? There's a question here.
No, medically, there is no definite relationship between thyroid problems and kidney problems. If they're there, they're coincidentally there together, but thyroid problems don't directly cause kidney problems.
Done. So here's Govind Yadav's question also. There are 3 or 4 other people who are asking advice for a transplant. My wife is a kidney patient. Her creatinine is 5 and she suggested for a transplant. What is the risk involved for a transplant? And a lot of other people are also asking, is transplant the only solution if it is advised?
Yes. So if you have kidney disease and it is chronic and you know it's not going to recover and you're almost reached the dialysis stage, yes, transplant is the solution for you. There are basically 2 types of transplants. live transplants and cadaver transplants. So live transplants are if you have a family member, a first degree family member. First degree means parents, siblings, children, and spouse. That's it. Uncles, aunties, cousins are not considered first degree. So if you have a first degree family member who's willing to donate, then we can evaluate both the donor and the recipient and proceed with the transplant. No risk or minimal risk to the donor, and the transplant patient or the patient who's got the kidney disease, there will be the usual surgical risks. Now, the other one is the cadaver transplant, where you can register yourself in the cadaver scheme, and then whenever kidneys are available, as per the priority basis, which is centralized, you can get a kidney allotted to you based on your priority number. About the risks of transplant. Now, before we look at the risk of transplant, let's look at the risk of chronic kidney disease. If you have chronic kidney disease, the chance of you dying is more than 60%. If you have chronic kidney disease and you're on dialysis, that means end-stage kidney disease on dialysis, in the first year, there's a 10% risk of dying. After 5 years, there's a 50% risk of dying. And after 10 years, there's a 90% risk of dying. So after 10 years of dialysis, 90% of kidney disease patients are dead. Now look at the statistics on transplant. After transplant, the main risks that you're worried about are three. One is infection, two is rejection, and three is long-term side effects of the medication that you're being given to prevent rejections and infections. So the major risk of rejection is about 5 to 10% in the first 1 year. It's about 10 to 15 or 20 after 5 years, and around 20 to 30% after 10 years. If you get rejection, you're back on dialysis. You're not dead unless something major catastrophic happens. Even if you have infection, you can treat it, and your life can be saved. So if you look at mortality or death, dialysis versus transplant, it's very, very, very clear that transplant is the best option for you. Yes, there's a risk in everything. There's a risk in Hyderabad. You can go for a drive, and there's a risk of an accident. It could be about 30 to 40%. That doesn't mean you'll not go for a drive. You will go for a drive. You'll wear your seatbelt. If you're on a bike, you'll wear a helmet. You'll drive carefully. You'll follow the signals, and you'll follow the rules. So everything has a risk attached to it. It's the risk versus benefit that you need to look at, and the risk-benefit ratio much higher in transplant as versus non-transplant.
Great answer, that is. This is how we need to weigh our options and then take a right decision at the right time. Thanks, Dr. Ravi. Next question is Neelima Adanki. I have nephrotic syndrome, and I'm steroid dependent, prednisone and list of medications since 2016. I want to get rid of the prednisone permanently. Is it possible?
Neelima, the most important thing is to find out what the underlying cause of your nephrotic syndrome is, because the nephrotic syndrome, like I told you, could be because of something called FSGS, it could be membranous nephropathy, it could be something called MPGN, it could be lupus. So there are a lot of reasons for a nephrotic syndrome, and your underlying cause of nephrotic syndrome will dictate what medications you require. But since you're telling me that you're steroid dependent, it obviously means that other drugs have been tried and did not get you off the nephrotic syndrome symptoms. So probably you will not be able to get off steroids. Now, looking at steroids as well, there are two types of steroids. One is called what the standard prednisolone or Visolone that we all know about. There's also something called deflazacort, which also is a steroid, but it has less side effects or less cosmetic side effects as far as other steroids are concerned. So if it's the cosmetic side effects that you're worried about as far as steroid intake is concerned, you can think about using deflazacort as a substitute. The other thing is you can limit the steroid intake by other immunosuppressive drugs. So it can reduce your steroid requirement to as low as possible. And of late, there are other medications, newer injections. One of them is called rituximab, which might help get you off steroids as well. So you need to first understand the biopsy report, and the nephrologist needs to understand what the underlying cause of your nephrotic syndrome is. And then he can look you over and decide, and we can discuss and find out which would be the best way to at least limit the dose of steroid, if not get off them.
Right, and I understand that the nephrologist and person with kidney issues is a long-term affair. It's not just like I've consulted, got my prescription, and I'm done with it. So you need to have a great understanding and a great bond between. This is a very strong.
Like a marriage. It's almost like a marriage.
It is. It is. So wonderful. So choose the right nephrologist. That's the only advice I can give here. And we have a great platform here to advise and give you options of nephrologists. That is Apollo 247. Download the app. All right. Next question, doctor. Here's Vinay Gupta's question. My mother had hypoglycemic attack twice, due to which her kidney shrunk a bit. She's 83-year-old. What precautions should one take?
Vinay, the first thing is the kidney shrinkage is not because of the hypoglycemia. The kidney shrinkage is because of chronic kidney disease. This is one of the ways we use as nephrologists to find out whether somebody has an acute kidney disease or a chronic kidney disease. In chronic kidney disease, the kidneys slowly shrink over a period of time and the size gets lower and smaller and smaller. Apart from that, an 83-year-old person also, the kidneys will be shrunken and get smaller as compared to when they were 30 years old. So the kidney shrinkage is because of that. Probably the hypoglycemic attacks that she has got is because of kidney disease. When you have kidney disease and your creatinine levels are high, whichever hypoglycemic agents or whichever diabetic agents that you take act for a longer time and they're more potent. So if the creatinine is elevated, you will have to be careful about which medications you're giving for her diabetes, and that would prevent these episodes of hypoglycemia. If she does not have diabetes and she has got hypoglycemia, this could also happen with somebody who has got kidney disease, where they're not able to process the sugars that they've been taking. So in that situation, you will have to ensure that she takes proper meals, more frequent meals, so that she is maintained, her blood glucose levels are maintained.
Okay, great. So another diabetic question, diabetes related question. Manmohan is asking this question. Can steroids cause post-transplant diabetes? How to manage the same? Is 10 ml apple cider vinegar okay to consume for post-transplant diabetes patient?
So Manmohan, yes, definitely post-transplant diabetes is an entity, and steroid treatment definitely can precipitate post-transplant diabetes. There are other medications also which can precipitate it, like the other immunosuppressions like tacrolimus and cyclosporin can also do that. But usually steroid is usually the most common culprit. And the treatment for post-transplant diabetes most of the time is insulin. Oral diabetic medicines usually don't work in post-transplant diabetes. More than 90% of those patients will require insulin to keep their sugars under control. As far as apple cider vinegar 10 ml, I don't see any problem with consuming it, as long as you don't consume it with sugar.
Done. Thank you. Calcium related questions. Couple of them I've seen while scrolling down. Will calcium or taking additional amounts of calcium cause kidney issues or kidney stones?
Right at the beginning, I had emphasized anything which is not in moderation can create trouble. So taking too much calcium definitely can create trouble. If you have a propensity or a tendency to form kidney stones, if you take more calcium, you will definitely likely be to have kidney stones. Calcium can also, if the levels go up, can also cause kidney damage. One of the causes of kidney damage is high calcium levels, apart from forming stones itself. So taking more calcium unnecessarily is also risky. So don't do it. And one easy method to measure how much calcium you require would be to do a serum calcium levels. That would tell you what your calcium levels are and whether you require to take calcium pills or not. And another point I want to bring out here, indirectly related to this question, is about the stones. Remember, there are three common types of stones. One are calcium stones, two uric acid stones, and three oxalate stones. So if you have a propensity to form stones, as a blanket recommendation, you have to make sure that you control these three things in your diet. Control uric acid intake, control the calcium intake, and control the oxalate intake.
Done. So there was one more question. Bladder stones and kidney stones, do these cause CKD is one question that I'd seen.
Bladder stones usually don't cause CKD, but definitely kidney stones, if they are not treated appropriately, or high risk behavior is done by not drinking enough fluid or taking too much calcium or taking too much protein, they can definitely cause kidney damage. But remember, these things causing kidney damage are less than 5%. Look at the big gorillas in the room. The big gorillas are diabetes and blood pressure and painkillers and unnecessary medications. Look at those things, and all these minor things will anyway fall into place.
Okay. Rohit Kumar Gupta ji, your question, if you don't mind, can you please type quickly your question right now? I'll take up the question because I couldn't find your question while scrolling. Thank you, Lee. Rajiv Odi, my left kidney is smaller than the right one. Is this normal?
Usually, the left kidney is slightly larger than the right. Usually, it's about 1 to 2 centimeters larger than the right. So, if the left kidney is smaller, then definitely there is an issue in the left kidney. The common causes of a small kidney, I'm talking about a single small kidney. If both of the kidneys are small, it's likely to be chronic kidney disease. But if only one kidney is small, it could either be genetic, that means it's been there since birth. The only way to prove it is to have earlier scans and look at the size of the kidney, say 1 year, 5 years, 10 years ago. The other thing could be if that particular kidney has undergone frequent infections or stone formation. And the third thing could be if the blood vessel supplying that particular kidney is narrowed. It's what we call
So
renal artery stenosis.
I see. Yes, I see additions to his question down below. Rajiv is also suffering from DVT. Creatinine level is 2.2. Taking warfarin as a blood thinner. Does this have an effect? Series of questions.
Yes. Warfarin per se does not have problems with the kidney. Of course, it can cause bleeding, but that's a different matter. The DVT warfarin is absolutely fine. So the small kidney, there's a possibility that there is a narrowing of that kidney artery, and we can prove that by doing something called a renal Doppler. And if the blood pressure is high and one kidney is small, there is a chance that there could be a narrowing of that particular artery. So if you could find that out and sort it out, at least your blood pressure might improve, your creatinine might not improve, the kidney function might not improve, because small kidney usually means it's the non-functional or a less functional kidney. So definitely you will need some investigations to find out why that kidney is smaller, because that's not normal. You expect the left kidney to be larger than the right kidney. The smaller left kidney needs to be evaluated further, especially in a setting of DVT and high blood pressure.
Done. Thank you so much for answering that. Braj Kishore ji पूछते हैं, I take painkiller regularly because of a migraine issue. As you have been telling that it can affect kidneys in future, what shall I do to avoid this situation, because there are no other means of reducing my headache?
Braj Kishore ji, there are a lot of other means of reducing migraine headaches. It's not just painkillers alone. There are these drugs called triptans, which can prevent the onsets of migraine, or even once you get a migraine, it can reduce it. There are certain injections. One of them which comes to mind straight away, I'm not a neurologist, but then I know about these things as well a little bit. So there's an injection called Subire, which can be taken once a month, and that can also reduce the intensities or even reduce the onsets of migraine. So you must meet, and there are other drugs called topiramate and all, which can be also used to reduce migraine symptoms and episodes. So you must meet a neurologist and get those sorted out, because taking painkillers is not going to be good in the long term. You might get kidney damage. So you have to be very careful about that. And you do have other options for migraine treatment.
Great, because we always think either we need to bear the pain or take the painkiller. So this is a great answer. Thank you so much. Here is Viplav. I lost kidney function due to anti-glomerular basement membrane, anti-GBM. Value was 283 in April 2020. Renal transplant on September 21. I wanted to ask why people say that it's not good to eat saag, green leafy vegetables.
I don't know who says it's not good to eat green leafy vegetables. I mean, there's nothing wrong with it. If you don't like the taste, then you don't eat it. But if you like the taste, there's nothing wrong with it. But in a kidney situation, somebody who's got kidney disease, and if the potassium levels are very high, then you're a little worried about having green leafy vegetables. And Viplav, as far as your anti-GBM disease is concerned, I'm glad that you had a transplant, and I hope that everything goes well post-transplant. And I'm sure there will not be any problems as long as you're taking medications regularly and your immunosuppressions. And absolutely no problem with eating green leafy vegetables unless your potassium is high.
Done. Here's Haidar's question. How many times can person have kidney transplant? Because I've seen in your profile as well that you are one of the nephrologists who's done successfully third transplant on the same person, right, doctor?
Yes. So this was a patient from Orissa, and he had 3 transplants, did well even after the 3rd transplant. So yeah, I guess there is no real limit. The only thing that will limit fourth or a fifth transplant or a second or a third transplant is if you develop antibodies. So when you have a first transplant, your body automatically produces antibodies which would try and reject a subsequent transplant. So there are methods to test the level of these antibodies. So if you've had a transplant and it failed and you're planning for a second transplant or a third transplant, we do something called antibody levels. And once we measure them, if they're very high, you avoid the next transplant, or you use some measures to reduce those antibodies. There are measures for that as well. You can do plasmapheresis, or you can use some drug called rituximab, which can reduce the antibody level and then proceed with the transplant. Otherwise, if the antibody levels persistently stay high, then you cannot have another transplant. So what dictates is the amount of antibodies that you produced after the first, second, or third transplant. Fortunately, with our patient who had the second and the third transplant, we could do plasmapheresis and reduce the antibody levels and give rituximab and proceed with the third transplant. So it's all again individualized, all depends on your antibody levels, and there's a test to find that out.
Done. Asmita Desai is asking about how do you reduce the rejection of kidney after transplant? A quick answer, please.
Yes, yeah, I think I can recognize you. So the chances of rejection are reduced by immunosuppression treatment. And the dosage of immunosuppressive treatment can be defined quite scientifically by doing the drug levels and estimating the kidney function as well. So that's it. You need to make sure your medications are regular. You don't miss a single dose. The timing of the immunosuppressive medications are also important. Some have to be taken before meal, some have to be taken after meal. And as far as possible, if you're taking 3 immunosuppressive medicines, try and stagger them, that you're not taking all of them at the same time. So these precautions need to be followed: the timing, the dosage, the duration between 2 doses, and the routine follow-up and the checkups to check the levels, and the creatinine estimation. With all these, you can reduce the risks of rejection to a significant amount. But the most important thing to remember is do not ever miss a single dose of immunosuppressive medication. So don't say in the morning, oh, I'm feeling lazy or I forgot, and miss that particular dose. If you don't miss the dose, the chances are much less. If you miss the dose of an immunosuppressive treatment, the chances of rejection are high.
Done. Thank you so much, doctor, for answering these questions very patiently. Rajdeep Gupta is asking, I'm 64-year-old and I had a transplant 18 years ago. How long should I expect it to last? And this, I think I've lost your connection, doctor. Am I audible to you?
Can you hear me? Yeah, I can hear you. Can you hear me?
Yes, I can hear you. If you can please continue. Rajiv had a transplant 18 years ago, and how long can this last is his question, doctor.
Yes, congratulations for an 18-year-old transplant which is functioning. It's really good for you. And if your creatinine is normal at this point of time, then there's a chance that it'll last forever, and you don't need to worry about a second transplant or any other problems. If it's normal now and 18 years, then your body has got adjusted to the transplant kidney. No worries at all. All the best to you.
Thank you so much for answering these questions with such great patience. And yes, I'm going to get my test done, my creatinine and routine urine examination done to keep my kidney health under a great check. Thank you again. So before taking leave, can I get some top tips to take care of our kidneys?
Yes, definitely. So remember, kidney disease is common.
Just a sec, Dr. Ravi Andrews. Dr. Ravi, can you please refresh your link once, because we can't see you. Your picture is stuck. If you can refresh the link and join us again, that'll help. We'll be able to see you.
Give me a second.
Thank you. Yes, please go ahead. There are a lot of questions that I could not take, but we tried managing a lot of questions so that your question can be answered through somebody else's question. Please do bear the paucity of time. We try and take as many questions, and it's important that the question gets answered. Also, there are a lot of questions which you cannot consult physically. That's where these queries get an answer, get addressed here. Most of the kidney issues, I think most of the questions that are asked here today are about creatinine. We have answered about creatinine in the first 20 minutes. I would request people who have joined us late and who have asked us about creatinine, please go back. In the first 20-25 minutes itself, Dr. Ravi Andrews has given a great explanation about how creatinine values affect our kidneys and what is the upper limit, what kind of progress it takes you to, and how do you reverse all these creatinine issues. That is one. And also about the stones and bladder issues and urine output issues. There are a certain amount of questions which are around urine, bladder, and stones, which I couldn't take them here because we have an expert nephrologist. Definitely a day when we have a urologist to address those questions, we shall take up. But for any other kind of nephrological questions that I could not take, Dr. Ravi Andrews is always available on Apollo 247. You can consult him because there are certain questions which are very, very particularly case specific and which cannot be answered generically for everybody here on this platform. So looking forward for yet another insightful session from Dr. Ravi Andrews soon. Dr. Raghavan, Dr. Right kidney removed due to cancer 12 years back. He's 75-year-old. Creatinine is normal. Now I have creatinine. What to do? Definitely we shall take this up once doctor comes back. I'm still waiting for Dr. Ravi Andrews to join us. Some technical difficulty, but we're also running short of time. So I think I should take leave from Dr. Ravi Andrews due to paucity of time. Let me see for one last time that. All right, let's continue. If Dr. Ravi Andrews joins us back, we shall take the top tips from him. Let's continue with the show now. Now coming up is health quiz. Health quiz is the time when you answer 3 questions of mine. I'm going to ask you 3 questions. You can answer the questions in the chat box, type the questions. The winner's name will be announced towards the end of the show. Once you are announced, Apollo 247 will select the winners. The winners will have to mail their contact details to marketing@apollo247.com. Here are the 3 questions for today. Question number 1 is, what are the filtering units of a kidney called? Our kidneys have filtering units. What are they called? Question number 2, how much blood is filtered by your kidneys daily? How much blood is filtered by your kidneys daily? Question number 3, which option on the Apollo 24/7 app enables you to book a blood and urine test with a doorstep sample collection? Which option on the Apollo 24/7 app enables you to book a blood and urine test with a doorstep sample collection? बहुत simple है. आप अपना app open कीजिए और देख लीजिए कौन सा है answer. Keep getting your answers coming in. I'm waiting for the answers. Yes. What are they called? Okay. Glomeruli, bitu, you think you got it? Let me see who's got the right answer. But before that, let me also tell you this is February, and this February is getting fabulous because on Apollo 247 you have Feb offer, which is flat 25% off on first 3 online medicine orders. The code you have to use on Apollo 24/7 is FIRST3, FIRST, first 3. And if you're paying via Amazon Pay, you can earn up to 500 rupees off too. So go ahead. The offer value should be more than 1,000. Apollo 24/7, you can use this Feb offer to get flat 25% off too. And also thank you all of you for joining us on this Sunday and asking your questions. So here are certain gift vouchers. You can use gift coupons that you can use on Apollo 24/7. You can use HH247. Next slide, please. HH247. You can get up to 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders when you use this code on Apollo 24/7 platform. Thank you all of you for joining us. By the way, next week we have a very, very interesting topic coming up. So COVID-19 vaccination for kids. All your questions and queries will be answered. Tune into Health Hour. And if you want a reminder for this, do subscribe Apollo 24/7. There's a bell icon. Go ahead, tap that, and you will get reminders. This is next Sunday, 27th February, 11 a.m. Do join us. And the winners for this week are Nilima Addanki, Ali Haider, and Duggaraju Sai Teja. Congratulations. Do write back to us to claim gift vouchers from Apollo 247. Chalo, thank you so much all of you for joining us and asking your kidney related questions. We shall see you next week with an Apollo expert. Thank you so much. Namaste. Take care.